and welcome back. It's about 9:33. September is National Childhood Obesity Awareness Month, and about 1 in 5 American children are considered obese. Compared to children with a healthy weight, children who are overweight or obese are at higher risk for other health issues, like both physically and mentally.
Dr. Cynthia Cantu, a primary care physician at UT Health San Antonio, joining us live this morning, talking about ways that you can prevent childhood obesity and help children start their journey to good health. Good morning, Dr. Cantu.
Morning.
Good morning.
So first and foremost, how do you know if a child is obese? How exactly is it measured?
So obesity in children is measured using the BMI. It is calculated different in children because it is age and gender specific. So it's important for children to be up to date with their physicals to determine if they are in this category, which would be being at or above the 95 percentile. So if in that category, basically your child's BMI is greater than the BMI of 95% of children in that category. So it's not as simple as calculating yourself, but seeing your primary care provider.
And with the pandemic, we've seen daily routines change. Has it had a significant impact on children being overweight?
Yes, recent studies are now being published regarding the increase in obesity during the pandemic in children. Particularly, you can imagine if schools were closed, there was less access to gyms, also less access to parks. Children were more sedentary and their diet patterns changed. They were not on a specific schedule. Even their sleep patterns changed. So it's something that we're continually seeing.
And so now that we're starting to open up, activities with groups of kids are starting to start back up. What are some things that parents and caregivers can do to help prevent childhood obesity?
Yes, well, going back to the basics, I think it's important that the whole entire family just engage in eating healthier. I know it's hard to just completely change your lifestyle, but you can just eliminate a couple of things here and there. Less chips, less sweets, particularly also less sugary beverages, and go on walks with your children or even go biking. There's a lot of trails, and it is safe to do it, especially because now with the everyone is socially distanced, and so you should feel comfortable to be able to go with your children.
And that's good for preventative, but what if a parent thinks their child is already obese? What can a parent do to start helping them reach a healthy weight?
Not put them in a diet unless the provider recommends that already, but I think just changing their diet is recommended. So just adapting, like I said, just change to healthier options and help them engage in exercise. For sure, less TV, less video games. Small changes really can go a long way. And then, of course, it's important that if there is other conditions that they're already developing, that they make the appropriate changes.
All right, Dr. Cantu, thank you so much for your time this morning. I really appreciate it.
Thank you so much. Thank you for having me.